Hello, everybody, and welcome to another episode of the Healthcare Education Transformation Podcast. I'm your host, Dr. F. Scott Feil, and I've got with me today somebody who I've followed and admired for a long, long time, Dr. Rebeca Segraves. Dr. Segraves, how are you?
I'm doing pretty well. I'm doing pretty well. Really happy to be here.
Well, tell our audience a little bit about your academic journey and how it's led you to where you're at today.
Yeah, I was a struggling PT student. I
Same. Yeah.
yeah, I really was. And I'm not sure if it was quite a linear path to exactly where I am today. But my story actually starts, as a rehab tech. A lot of us, our students, started their career that way. But about 3 months before I started PT school, I'm really happy, excited about my letter and getting in. My mother had a massive stroke. And the way that she had a stroke, it was 24 hours after going to what I later learned was a factory mill PT,
Mm,
which, you know, I was aware, but I was so like careful in picking out this clinic that I didn't catch it. I
hmm
didn't catch that, uh, hey, this PT is juggling three other patients. And my mom is on machine after machine, and she was not the healthiest woman, definitely, sedentary. I was a personal trainer at the time and a rehab tech. And so I was home for the month. I had left those jobs and was taking her blood pressure, and it just beat through the roof with just walking outside, like
mm,
160s over like 90s. And it was just like when I saw her in the clinic, my gut feeling was like, this is not right. But I also had the worst case of white coat syndrome you can
sure.
imagine.
Yeah.
So PT was a doctor of PT in a white coat, and I was just silent. I was just quiet. I was like, let me stand down. And it was like the third machine. My mom was like on a treadmill. She's never on a treadmill, never on a new step, never on elliptical. And it was like she hadn't taken her blood pressure once.
Mm,
And so, anyway, that's kind of how my career started. Like 24 hours later, we were in the ED. She had lost her ability to speak, lift her arm. Took about 36 hours to get MRI results, but she had suffered two strokes on a parietal lobe and
mm,
I never walked out of the hospital again. And I really carried that through PT school. I struggled. I failed
yeah.
so many practicals. I was always on I remember the camera was like this close to my face because they had to document why they were going to kick me out of PT school if I failed this one.
hmm
And I just remember having to perform with the camera right there, and the program director was holding it. And I was like, oh my gosh. But I got through it. And I remember my professor telling me, innovate after you graduate,
Yeah.
because I wanted to change the world
Yeah.
then
Yeah.
after that experience. But I could hardly like, pass. And so he was just like, just get through, just graduate.
Yep.
And so, yeah, I mean, I don't know that that really has PT school wise, I think just getting through was really important, but I think I've used physical therapy as I would have used any profession. It's a vehicle.
Yep.
It's a total vehicle for me. I could have probably done what I'm doing as anything, but I'm glad that I eventually stuck with it and chose to do it through PT.
Yeah, so a lot to unpack there, right?
Yeah. Yeah.
First, first thing, again, my career not very linear. I was an English major before I was a PT, so that was a disaster. I didn't know I had ADHD at the time. I do now, so in hindsight, it makes sense. So I struggled, but got through, right? And I have this conversation a lot with people who are in like terminal degrees, and they're like, "I'm gonna change the world with my dissertation." I'm like, "No, you're doing it all wrong. Just get through the dissertation, then work on innovating and changing the world. You just got to get those letters, finish it, get the piece of paper, then you can start implementing your journey towards bigger, better things, right? Because PT school, getting through that is, in my mind, really just a ticket to get on the bus to then start your journey you know and the same thing with the educational doctorate. When I did that, I was like, I don't know what I'm even doing. Like, why am I even, I don't even want to teach. Like, what am I pursuing here? What am I just thought, if my hands give out or my back goes out or whatever and I can't do therapy anymore, I could always fall back on teaching, but I was just going to retire at some little beach community and teach like one course, at a community college just for fun in my retirement age. But I'm glad I did it because the opportunities that it afforded me, and when people ask, like, oh, well, is PT still worth it? And it's like, well, just like anything, it's what you make of it. So, like, is 150 to $200,000 student loans worth going to PT school? Well, it is if you leverage it correctly, right? And so I think, like you said, you could have done what you're doing in any profession, but you're doing it through PT. That's the medium that you're choosing. And I love that because that's a great way to reframe it.
I love that you said leverage because that's exactly it right there is it doesn't matter. And I think working a lot with just other business owners, I was at a kind of a sponsorship for Black female business owners through Goldman Sachs, and they said everyone that you need to help you succeed is in this room. And it was really about leveraging networks. And it was just like bonkers to me. Like, why didn't I ever think of this before?
Yeah.
Like it didn't really matter, oh, I was a PT or had a healthcare background. It was the other knowledge that I brought to the table and then their knowledge that they brought and who they knew and who
Aggregate.
they
Yep.
connected. And it was just like, oh my gosh, it just like clicked for me.
Yeah.
But yeah,
So that cliche phrase, right? Your net worth is your net work, right? And I don't think we go over that stuff a lot in PT school because school in general is based off of old school methods that the Rockefellers came up with when they needed worker bees and employees, right? And so that's why the school system, that's how it's structured. And now you go into graduate school and it's still structured that way. You're being trained a skill, high level albeit, to then go get a job, right? And so it's a little bit tunnel vision and we have to start thinking a little bit more of like, how can I really take every opportunity that I have to make it a learning experience, learn something from it, take something away from this every interaction, and then that helps to start building relationships, and that's where the real meat and potatoes is, right? It's like those relationships, you never know who's going to help you, how they're going to help you, who's going to come in and out of your life. The networking part of it is something that we really should be focusing on even at K through 12, right? Like, hey, relationships matter, right? Like there's people who are all business and tactic fit focused, and then there's people who are all wishy-washy emotional, relationship. And both of those sides are pitching for their team when in reality, it's a combination of the two that makes successful businesses, right? And so I think it's important that we really start to say, well, the soft skills that we learn are good and we need those, but you also, the best time to network was 10 years ago. The next best time's today, right? Just like planting a tree. So I tell my students, like, you have to start networking. I don't think I've applied for a job in the last decade.
amazing.
It's always been I've been referred by someone, somebody referred me, to somebody they knew, or somebody knew my skill set and reached out to me and said, "Hey, I think we got a good spot for you. Would you be interested?" That doesn't just happen. Like it's not magic. It doesn't fall into your lap. It's years of hard work and dedication and networking that then makes the opportunities present themselves, and it's being able to pounce on those opportunities when they do arrive.
Yeah, I love that you said that. Haven't applied for a job. Yeah, no, I love that you said that. I learned that in residency actually that I have accumulated like a bunch of stories of just failures. And the one success I think that tipped it off was this grand rounds that I did. And the the CI I had at the time looked at what I was going to present in front of this massive team at Duke, outpatient and inpatient therapists, and then the residency program director, and then also like the director of rehab at that time. And she said, Rebecca, you're missing something. And I was just like, what? What's wrong? She was like, nothing in here, it makes me want to laugh. Like, you don't have humor. You don't have anything in here that's funny. And I made a few tweaks, and that day I delivered. And I had, the audience like uproariously laughing. And I remember leaving that residency, starting it, not knowing if I was going to complete it, but then leaving it with 5 really high competitive job offers, that I just I don't remember even really formally applying. It was
Yeah.
just that they had heard of me through
Yeah.
someone. And I honestly think that happened in literally the last 3 or 4 months of the residency from that presentation. And I decided, man, maybe public speaking was kind of more something up my alley. And I started getting a lot more interested in the delivery and the communication aspect of our profession.
Well, you're speaking my language, right? As an English teacher, storytelling is my jam. I love it, right? A little bit long-winded sometimes, probably, and I'll own up to that. But I'm also from New York, so that's just part of the gig, you know? But I will say this, like, in order to effectively deliver education, you have to have a good grasp on humor and when to introduce it, when not to, when, how to introduce it, like what makes sense, what doesn't. And you got to keep it a little lighthearted, you got to have, because if it's just sage on a stage, here's my PowerPoints lecture after lecture, we know that doesn't work, or at least I know it didn't for me, right? And the studies back that up, right? So we're trying to move away from that. We're trying to get off of that, that model, albeit slow and steady. But I think that there's a lot that can be said with humor and with storytelling because it's relatable, right? It's the human element. It's what makes us all just like, oh yeah, I can relate to that. That's funny. I get that. Yeah. Oh, that's happened to me, right? It's those little mini connections we can make when it's not a one-on-one conversation, but maybe it's a larger audience, like students or patients or a large group that you end up speaking to.
Yeah. Oh, absolutely. Yeah. No, I didn't honestly think I would like public speaking as much, but then I realized if I didn't, I don't think I would have moved the needle forward. You know, a lot of my specialization has been in women's health, but I don't think it would have made the impact had I not embraced that side
Yeah.
of what I really, I mean, love to do. I mean, I'm from New Jersey as well, so Northeast,
Hmm.
but yeah, it was the storytelling aspect for me. It was
Yes.
it was taking people's stories and then like transforming that experience for the healthcare team to to kind of get it in a different way.
Yeah.
Yeah.
Yeah, because a lot of this stuff we learn is dense, right? It's
Yeah.
tough,
Oh
it's
yeah.
heavy, it's thick. You got to lighten it up a little bit, right? And like, I mean, I very rarely take myself too seriously, and I know I'm not generally the smartest guy in the room, and I'm okay with that, right? If I am, I'm in the wrong room, right? I want to be learning. I want to be taking these things in and experiencing them and sharing those experiences with other people, right? And I think as physical therapists, we do a lot of it and we don't really realize it because you educate patients on a daily basis, right? Like I felt like 70% of my job was like educating all day, So it was interesting that I ended up finally going into academia because it was like, all right, yeah, that makes sense. That tracks. I like teaching. I like talking. I like getting in front of people and telling a story. And it has to be a good story. It has to be relatable because again, the impact is huge, right? Like if you're the best physical therapist in the world and nobody knows where you are, what you offer, who you are, because you're not shouting it from the rooftops, nobody's going to come to you. Nobody's going to see you. So it's a little bit of like the greatest showman on earth type stuff, right? You got to be a little bit of a marketer at the very least. You got to promote the heck out of yourself because no one else is going to do it for you, right? And I'm not saying like you have to be a narcissist or egotistical, right? You just have to say, hey, here's my services, here's what I'm good at. I want to help more people and have a bigger impact. So I've got to shout it from the rooftops and let everybody who needs my help know I'm here and I'm available for you. You know,
Yeah.
simple as that.
I'm so glad you said that because I found more times that I didn't have the resources to educate people. Like I was feeling definitely as a new grad stuck. I would see things that I just there's no way. I mean, I couldn't explain whether it was someone had, crazy injury, freak, diagnosis, whatever it was. And I remember going to this dentist one time, and I thought this was brilliant. What they wanted to do was obviously like use my case to educate someone, but the way they presented it to me, I thought I got to take this and bring it to physical therapy. But they asked me my permission, but in a way it was so like creative in terms of like, hey, can we take pictures of you? We've never seen anything quite like, I'm just gonna embellish here, but so beautiful as your smile. So we want to take these pictures of you. Um, and they actually did like say something to that extent. I was just
Yeah.
like, wow, like super flattered. But it was like, we really want to teach this aspect to our students, to our patients, and we would like to use you. And I started doing that like really early on. I'm talking about like a year out of school where I was drowning and getting people's permission to tell their story.
Yeah.
And within a couple years, a small local news station wanted to pick up, some of the patients that we were treating. And I think that news story kicked off how we were able to basically serve women after mastectomy within 2 weeks. Like before, I was waiting months to see these
Yeah.
people. Like they had all of this like scar tissue, lymphedema, all this stuff. And I was just like stuck. I was like, it's too late. I was pretty humble even then, but I even knew there wasn't much I could do once they got to that stage. We have to see them a lot sooner, but I didn't really know how to move the needle forward. And so before I ever even went to a physician, we got picked up on the news
Yep.
first.
Yep. Yeah, I mean, attention goes where focus, or attention grows where focus goes, right? So like by bringing awareness, by shouting it from the rooftops, like being on the news, having these little bits and pieces here, it at least brings awareness. That's the first step, right? Like, because there's people that need our help and don't know they need our help or that we even exist. So you have to have ways to creatively advocate for ourselves, right? I call it advocating, marketing, whatever you want to call it, but like, it's and it comes back full circle to the storytelling thing, right? Like that's what testimonials are. That's what client wins and case studies are, that like we're using these so that again people can relate and be like, oh, that guy had the same knee injury I did and he did great. They want to see that so that they know, oh, you can handle this because you've seen it with this guy and done it very successfully. Great. I'm on board. Let's do it. Telling people stories and their wins and their successes and sometimes even their failures help with the human element of getting it and grasping it and then getting that buy-in. So I think it's super important that we realize that and utilize it to our benefit, because the more people we can let know that we exist and what we do, the more people we can help, and then it comes back again full circle to impact, having a larger impact.
Totally agree. I'm having a struggle right now. Some therapists are in acute care and they're like treating women in the hospital after birth, which kind of like new and emerging, right?
Yeah.
But they don't want to write these case studies. And I'm like, dude, you have to write.
Yeah.
You have to. Like you don't need to say, "Hey, I have all the answers." It's not the point of a case study.
Yep.
But you do need to write about it because it's emerging and you're an authority in this space. And so I tell people now to this day, like, write, talk about it. You don't have to have all the answers. It doesn't have to be perfect, but you do have to document the journey. More people are interested in the journey. They don't care
Yeah.
about the destination as much.
Absolutely. I mean, that's my whole thesis on mastery, right? Like you have to have the North Star. You have to say, I'm going to try to master that thing, and now my journey begins. And you're going to fail along the way, you're going to struggle, but like at least, and you may never become the Michael Jordan of that thing, and that's fine, right? But at least if you're trying with intention along the journey, you're going to get pretty darn good at whatever it is you're trying to accomplish. You're going to learn some things along the way. So it's worth it to just enjoy the ride, right? Enjoy the journey and document, because people need to hear it. They need to see what's out there, what's being done. We need more awareness to these things. Which kind of brings me to our next topic here, and that's really just about decision making, right? And like what kind of decision making and how much power do we have? How much say do we have when it comes to healthcare decision making, right? Especially as patients, because I've seen a lot lately on social media where healthcare providers are either getting crummy care or they're not being listened to, or their loved one or someone in their family is going through something heavy and they're not being listened to, and they're trying to advocate for their patient or their family member or their loved one, and it's not really going as smoothly as it should. So like let's talk a little bit about that and like, how much say we really have when it comes down to healthcare decision making.
I love that you brought that up. I mean, I think that the patients actually have a lot more decision making power than anyone else on the team. A lot of times when I was like
Well,
doing
they
those early,
should if it's done right, you know?
if it's done right, but that's the thing. A lot of times when I was doing those early interviews, even I knew at the time their story would sell more than I would.
Yeah.
Anything I could say on this team, and I was the black sheep of Appalachia. I was in Asheville at the time practicing, and I knew if I could get the locals to talk about their experience, it was going to be a game changer. I knew that at that time. They didn't need to see my face, they needed
Yeah.
to see their own community.
Yep.
And so, honestly, it was really for me the decision making in healthcare. It lied with the individual just knowing that they had that kind of like power. I
Yeah.
mean, it is a power play. And it doesn't need to be, oh, you need to know certain things. You need to have this level of knowledge about this diagnosis. No, you just need to say what you want and then express when you don't understand something.
Hmm.
And once you did that, it slowed everything down. No one could rush the process if you weren't on board. And I knew that probably my greatest power, having seen that experience with my own mother, was trying to figure out a way to tell this person, you have more power than I do right now. I can't move the needle on this. If you want this imaging done, or if you want this type of treatment, or if you want to see me a little bit earlier, I need you to speak up and advocate for the order. I do that now with therapists who are treating mothers in the hospital after birth or pelvic surgery. We know those patients don't really get physical therapy early. So the best thing they could do is actually go to them before they're in that situation and when they are. And this is super rare. I mean, when I talk about it, I realize, man, I was in a privileged state. I'll be honest with you. I don't know anyone who was able to walk into a patient's room without an order and ask if they wanted their services, you know?
Yeah.
And I would be able to actually solicit my services just based on having a conversation with a person without an order. That's super rare. So here I was, no order in hand, able to educate a person about what I could do, but it was their word. They had to say yes, and then I could get the order.
Yeah.
It was the patient's determination. If they wanted physical therapy, they would get it. The doctor would put in the order. It wasn't me.
Yeah.
That's decision making. That's how it should be. People should
Yep.
be ordering their services. It shouldn't be us determining when they get it.
Yeah. So that's kind of how we got direct access in Texas. At least a little taste of it was a grassroots effort by a lot of the patients, not by PTs saying, "Hey, we need direct access." Like, yeah, that was part of it, but like it was mostly patients saying, "Hey, we want the right to choose to be able to go and walk in off the street if my shoulder hurts and go see a PT to fix it." And finally the stars aligned and a bunch of pieces fell into place and finally we got a little bit of direct access. It's like, it's still pretty limited, but it's a start, right? And so, I don't know how short the leash is and what they're willing to do with us and work with us, and we'll see where that goes. But until all 50 states have unfettered direct access, we got a lot of work to do. I mean, you know, we're in for a long uphill battle. So, I hope everybody
That's
out there keeps fighting the good fight.
It's funny that you say Texas because that's where the hospital was that we started a lot of those services that way by going to patients first was Houston. So
Yeah,
Texas, I don't know. I just feel like for me in my career, they've been a lot of times doing some pretty cool emerging stuff that I've wanted to copy and paste other places.
yeah,
Is that Texas kind of operates on their own, like on their own rules, you know?
yeah. That's an understatement. Being a Texas transplant, I can attest to that. Um, it's a wild place, man. It really is. But let's talk a little bit about empowerment. You alluded to it a little bit with the decision making, right? But like, what goes through your thought process, or how are you delivering the message to patients and educating them on empowerment and where to take it and what to do with it?
Yeah, a lot of it is humility.
Mm,
Like, it's a patient population I've started to love. It's like total, people after a total shoulder replacements. Have you ever treated this patient population?
Yeah, yeah. I worked home health a lot, and just toward the end of my clinical career, started seeing a lot more of them. And I was like, oh, okay, this is new. This is interesting. All right.
It's definitely, I mean, it's just to me, they're fascinating. And because, I was steeped really in my specialization for a long time. And I was just like, I got to branch out and get back to ortho.
Hmm.
And I find that population, at least, I'm going to just say maybe with Vale Clinic here in Colorado, they do a great job of educating the patient, not necessarily on the surgery, right?
Yeah.
They're not like kind of like putting it on people's head of like exactly how they cut and what they
Right.
did and all of that. But when it comes to their rehab, their recovery protocol, they got it in hand and they're like, I know I can do this. I know I can do that. And then they're just like in it, right? And I've built a lot of the women's health stuff on the orthopedic model of care. I mean, I just love it. I think I'm a die-hard rehab for life is because the amount of empowerment that those patients have coming out of ortho surgery and just them knowing what their course of care is going to be. And I'm speaking again, probably very narrowly for your audience because they've probably seen the other side of the spectrum where someone's after a knee replacement hasn't been told anything.
Yeah.
And I could completely appreciate that, but at least in my experience, is something that I've appreciated when I compare it over in women's health and someone's after a mastectomy and they're just as swollen in all the areas as someone after a total shoulder replacement. They're swollen in their torso. They can't hardly lift their arm in certain ways. They hurt putting on their shirt. They're swollen down to their hand, and they
Hmm.
haven't been given any protocol on recovery versus this person after a total shoulder replacement. And I'm like, this is where it's at.
Yeah.
The
Same,
empowerment
same,
actually
same game.
starts. It's the same game in a
Yeah.
way. I mean, different people, different surgery, but it's the same game is that we're giving people all of the information that they need to succeed versus in these other areas we're not. That's the change.
Yeah.
That's the only thing that's different is that someone has information, the other person doesn't.
Yeah.
And when I think about that, I'm like, holy crap. So that
Yeah.
that makes my job so much easier. I don't have to burden this individual in any other way. I just have to give them the information. That's empowerment.
Mm. Well, I mean, again, I live in a lot of cliche phrases. I know people don't like those, but knowledge is power, right? I mean, you got to be knowledgeable about what you're going through, because to some extent, you're going to have to be taking the responsibility of your own health into your own hands. And how you succeed or fail is going to be based a lot on what you know and what you choose to do then with that knowledge. But if you're not given the knowledge to begin with, you're at a huge loss, right? Like you're already behind the eight ball, and then you just don't do anything, and then you get bad outcomes and you wonder why, right? So like it's important that we are educating, at every step of the way as much as possible, and then making sure that the education's received and understood, because I used to yes and no people to death. Like, hey, did you get all that? You understand that? Mm-hmm. 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 Okay. Then they come in the next time. I'm like, hey, how'd that thing go? And they're like, I don't know what you're talking about. And it's like, you told me you understood everything. It's like, oh, I didn't ask you the right question. I asked a yes or no question. You yesed me to death and you left. So now we get into a little bit more of the Socratic method of like asking better questions. And now it becomes like, okay, in your own words, can you tell me what you learned today at physical therapy and what you're about to then go do, right? If a loved one asks you, hey, what did you learn in physical therapy today? And what do you have to do? What's your homework, right? You can tell me in your own words so that I know you understand what we covered and that you grasp it. Right. And I do that same thing with my students early on in my teaching career. I fell into the same trap, and I asked yes, no questions a lot. And I was like, damn it, I am repeating the exact same thing I did with my patients. So it took a little while to get out of that and realize that, there is an art form to transferring knowledge. But that is the hugest, benefit we can provide to patients for a good outcome is just having the knowledge and making it digestible, right? And making sure then that it's understood.
Yeah, absolutely.
I love that approach. I think, again, biased in the academia world, but like it just makes me, appreciate more a good educator, like because I know I had some rough ones in my day. I again we go back to the sage on a stage model, and it's like, oh well, that didn't work for me. Like, what else is out there? What else you got? And so you got to find what works for you, and it's going to be different for everybody, right? Whether or not you believe in a individualized learning styles, at some point you got to pick one and stick to it, right? You got to just like, hey, I think I learned best this way. Okay, great. Here's that way. Like here's the thing you need to know in the way you need to know it. Do you understand? Can you comprehend it? Like tell me that you got it, and talk me through what you think it is that we're supposed to be doing here. And that sets
Absolutely.
them off on a
Yeah.
good foot.
I mean, as students, we were meant to adapt. Like we had to. We had to adapt to the instructor's style or mode or preference of training us, right? And I found that I love those instructors that story tell, that
Yeah.
could tell a good story, talk about a patient experience, and wrap it into the neuro or geriatric lesson or whatever it was. And stage on a stage, I mean, if you had just slide after slide after slide, I was lost. I was lost in your course, but I had to adapt.
Yeah.
And so now, I mean, I do the same thing with patients. Like I have to adapt. I mean, treating patients in Appalachia was so different than Houston, Texas, which was so
Big.
different than Colorado Springs, which was so different
Yeah.
than Washington State. And I was just like, man, I can't tell this story to this person. They need a different mode. And honestly, a lot of it was just humility,
Mm.
you know,
Yeah.
humility and just knowing I had to be adaptable as an educator, um, to the person that I was treating.
Yeah. It all goes back to like personalized and individualized care, right? You're going to have different cultures. You're going to have different belief systems. You're going to have, different healthcare knowledge and literacy. You're going to have, tons of, and you just have to be able to deliver at every level for that patient, like whatever their learning styles are, whatever they get. I've played charades before to get my point across. I mean, you got to figure it out. You got to find ways. And so I definitely think the good news is I see a lot more in academia now, people recognizing that if the students aren't getting it, it's on them, right? And so now you've got to make the charge to change it up, individualize it, deliver it in three or four different ways, find what works and what doesn't. Yeah, it's a lot more work, but it also works. So I think, we have to adapt, like you said. We've got to figure out, and truthfully, at the end of the day, it makes you a better individual, a better communicator. And I think that's the level that we all need to get to, especially as healthcare providers, if we want to have a bigger impact, right? You've got to be able to communicate your message clearly, effectively, and so that you get that buy-in and belief systems, to support the movement you're trying to make, and get people behind you and get people buying into the bigger vision and like what can be the possibilities.
Yeah. Yeah. And you just going back to academia, I mean, I think that you could probably appreciate this a lot more. But from a student perspective, I was probably really privileged to have a faculty that was adaptable, you know, like that was willing to adapt and change things, for me when I needed it. I don't think I appreciated it then as much as I do now in terms of just getting through PT school. I needed that flexibility. I was a non-traditional student.
Hmm.
I was flying back home quite a bit. I was the power of attorney for my mom, who had just had a massive stroke. And we were trying to coordinate nursing care for her. And from a student perspective, that adaptability from my professors probably had the biggest impact on me as later on a healthcare professional.
Yeah.
Yeah.
Yeah, I mean, there's a sense of empathy there. There's a sense of understanding, and just the human element. Like, all right, we get it. Like, this is hard for everybody, but you're going through some stuff, and we got to figure it out. Let's make this work, right? And I think recognizing that and being adaptable, again, kind of makes for a good teacher, I think. Um, but I also wonder too, like, how far can we push the limits of adaptability? Like it gets a little scary when we try to do that, right? Because you're thinking like so far outside the box. It's like I remember in particular, like, so I went to Wake Forest for my undergrad, right? And then East Carolina for grad school. So I was in Carolina for a good portion of my early career. And I'm from New York, and we don't know jack about NASCAR. Like, we just don't. New York doesn't have NASCAR, right? But I had a patient that like that was his life. He came in with the Dale Jr. shirt and the hat, and that's all he wanted to talk about was racing. And like, the guy wasn't making any progress. And I'm thinking, like, how can I get through to this guy? Like, he's not. And then finally, I realized I was like, I need to learn NASCAR. I need to figure this out so I can connect with this guy and get him to buy in. And some of the analogies I was using, like, I don't know if they made sense, but they did to him. So it was like, great. Now I'm a NASCAR expert. Let's do this. Let's make some real connections here. If you had told me, 40 years ago that I was going to be into NASCAR or learning NASCAR to make a connection with a patient to like get them better, would make no sense. But I was willing to try and like push my boundaries in my comfort zone. And that to me was like thinking a little bit outside the box because I was like, I'm bringing NASCAR into the clinic to get this guy better. Like, are you kidding me? Like, I didn't go to school for NASCAR, I went to school for PT. So, like, connecting those dots sometimes seems a little disjointed and seems like out there, but I think that's what we need to do and try new things and be, brave enough to fail and like be like, well, that was a swing and a miss. Let's figure something else out. Because what's the worst case scenario? Like you look like an idiot or a fool in front of your like patient. Like, all right, well, I'm trying my best here. I'm doing what I can, but I need you to get this. I need you to understand this. If we go back to the empowerment thing, in order to give you the power you need to succeed, I need to get through to you. I need to make sure that we're understood here and that you've got the knowledge you need to be successful.
Yes.
So
It's so
just
funny that you said that. I remember I was writing my first commentary for a physical therapy journal, and they were telling me, you need to submit this somewhere else. Like, this is women's health. And I remember arguing. I mean, in those days, this was back in 2000, they let you speak with the reviewer, or at least the reviewer was like, if you have any questions about my review and why I said what I said, you can contact me. And I'm thinking, okay, this is acute care. We're talking about C-section. This is not a women's health topic. To me, it was like plain as day. But to everyone else in the world, they were just like, what are you doing? This is totally a women's health topic. But I was like, no, this isn't abdominal surgery. And no women's health therapist is going to walk into a hospital room and treat this patient. So we need to reach acute care therapists. And I was not a writer at the time. I wasn't, but I knew how to argue.
yeah,
And I knew how to like talk the guy down. And the review passed and we published. And I realized at the time, if you would have told me I was going to be writing and public speaking and doing all this stuff to like kind of disrupt women's health physical therapy, I would have said you're a liar. I can't even pass the practical that I have next week, Like, what are you talking about? And I had to adapt. Adaptability, when you talk about patient empowerment, when you talk about like access to care and all this stuff, it's like, well, it actually falls right back on us. Are we willing to adapt it so that people can get information they need sooner? Are we able to adapt ourselves to say, hey, this model is not working. I refuse to work in this model of care that I know is just going to hurt people. And I mean, that's beautiful that you said that, because I think that that's kind of defines my career up to this point. It's been adapting constantly and then also disrupting viciously.
yeah. So, I mean, I think physical therapists are primed for this because we adapt all day, every day. We adapt exercises, we adapt plans of care, we adapt equipment, we get problem solving and adapting. You're just transferring the skill set now to a bigger platform or medium to then again have more impact, right? So, like, we have the skills, we learn them in PT school. You just got to get the blinders off and apply it to bigger, better things. So let's talk about the disruption part a little bit. What's next? What are you working on? What are you trying to disrupt now?
Yeah, I think it's just communication and leadership training. I've been really excited about kind of more of an effort to train children when they're younger to communicate,
Mm, yeah.
about their bodies. Like, I mean, I was one of those kids that always had to go to the bathroom. I was probably a little bit of a um probably seen as a troublemaker in school and was told, like, no, you're going to get a demerit. And those points, it was like points off if you like use the bathroom or if you disrupt class and things like that. And I realized, there's, quite a few, um, commentators on this that are coming out and basically saying is that when you teach a child to ignore their bodily symptoms, they become
Yeah.
adults who ignore, um, ailments or signs and symptoms of what might be wrong. And I find that I really love the communication and teaching aspect, but I want to do it in a way when people are young before they get to that point, before they become the woman after a mastectomy who doesn't get rehab. And now she's kind of lost and doesn't know what to do. It's like, no, I don't want to see more of those patients in the future. I want to see more of those patients actually coming in and with their own plan, that they have a plan. They don't need my plan of care. They have a plan to already start rehab on day 3 after
Yeah.
a major surgery like that. And so what's next for me, I think, is really a lot more communication and
Yeah.
public education. And I'm excited about it.
Yeah.
Yeah.
That's awesome. I'm so glad to hear that. Like I said, I can't wait to see where it goes. I love following your journey. I love, seeing all that you do. So I'm excited for you. Uh, I can't thank you enough for taking the time to come on and chat with us and just kind of tell your story and thoughts and ideas on how we can make things better in the world of healthcare and education. We ask all of our guests this one final question, and that is, if you could change one aspect of higher education, whether it be DPT or otherwise, what aspect would you change and how would you change it?
Definitely in just in terms of, I think for me, I would probably use those opportunities that we all have to give, a lecture or a presentation. And I would probably make it so that more people can access
Mm,
those types of talks. I want more people to actually have the opportunity when they're in school to give a public lecture,
yeah,
something that's accessible via Zoom to the community, or something that's accessible maybe to the university at large as a student. I think public speaking is our future in every regard, every healthcare provider, but especially physical therapists, because we spend so much more time than other profession excuse me, than other professionals with our patients.
yeah.
To me, I think the next frontier is going to be more public health education from the physical therapy lens.
Yeah. So, TED Talk PT version that then leads to more population health based because now it's not one-on-one treatment. Now we're talking to populations, right? Here's my expertise. I work with this population. Here's a talk you need to hear. Like,
You got it.
why not? We have the knowledge, we have the education. It's like we're seeking permission for no reason. Like, just do the damn thing, Like, I don't know why we're all again. I'm very biased. I've been beating this drum for many years. I just don't think patient care is the end all be all for us,
Not at all.
especially if reimbursement rates keep going down and we're not really seen as true, primary care practitioners, and we're seen more as a modality. Like, if you keep going down that road, it's a race to the bottom and nobody wants to win that race. So what are the other opportunities available to us? And you just mentioned it, public speaking, right? Education for populations. Like, we have the knowledge, use our skills for good, right? Like, go out there and help more people, because why not? Like, it all comes back to impact.
100%.
Well, Rebecca, again, thank you so much for taking the time and for chatting with us today. Where can people find you or reach out to you if they have follow-up questions or just want to see what you're up to these days?
Yeah, my first and last name spelled with one C, Segraves, no A. A lot of people get mixed up with that, but Rebecca Segraves, Instagram, Twitter, all over social media. Yeah, people can find me there.
Awesome. We'll put all those links in the show notes so everyone can find you easily. Thank you again so much for your time. It's been an absolute pleasure chatting with you today.
Hey, my pleasure. Thank you.